I wanted to cover three things today. What happens in a normal coronavirus infection? How does a normal vaccine work? And how are the coronavirus vaccines that we have different from what we've had in the past? First of all, some biology about how viruses infect. The virus is actually called the SARS-CoV-2 to differentiate it from other viruses. The virus comes into the body either through the mouth, air passages, membranes, such as if you touch your eyes or your mouth after you've touched it. It attaches to one of your cells. In some cases, it can be epithelial cells, or perhaps if it gets into the blood, some endothelial cells with the blood supply. It attaches with the spike, what's known as the spike protein, that attaches to a protein on our cells. It then works its way into the cell, it uncoats, and at that point, its genome, its RNA, is released, and that RNA contains the codes that our cells use to build the virus. They build viral proteins, they build viral enzymes, and eventually assemble the virus, and the virus buds out through the cell membrane. When enough of these have budded out, the cell dies, and the virus then attaches to the next cell and the next cell until you end up with a viremia, or viruses showing up in the blood. This is not unusual. It occurs with many other viruses. One thing different is that it's a respiratory virus that goes internally, cold viruses do. The second thing is, how does a normal vaccine work? Normally, when we prepare a vaccine or immunization, we extract proteins or use a crude extract of a virus to inject inside the body, usually into muscle tissue, because that makes the antigens, these viral proteins, stay around for a while. And as they're there, they stimulate the body to produce antibodies, which then coat the virus if it shows up and neutralize it. It also clears the virus or viral proteins out of the tissues. It lasts several weeks. It produces what's known as the primary immune response, which is a low-grade type response. The difference with these vaccines, and currently we have 3 that are approved in the United States. 2 of these, instead of packaging viral proteins, actually coat or inject in small fragments of RNA, synthetic RNA, that code for the proteins, specifically the spike protein of the virus. The difference is, instead of going through the purification process and the long time frame involved with making sure it's safe, instead they synthesize the RNA, put it in small liposomes or lipid structures, lipid vesicles that we inject in the body. These liposomes attach to your cells, introduce the RNA just for the spike protein. Your cells then manufacture those spike proteins and nothing else, and those then are released into the circulatory system, and the immune system responds and attacks those proteins if they show up again in a real virus. The difference is, we're injecting nucleic acid rather than the proteins, which are cruder extracts. The Moderna and the Pfizer-BioNTech are both RNA-based. The difference between them and the Johnson & Johnson or J&J is the J&J is the same type of synthetic RNA, but it's put inside a virus shell, an adenovirus shell, that attaches in a different way. And it releases DNA. That DNA is then imported into your nucleus. The nucleus then produces the RNA goes out and then manufactures the protein, just like the other vaccines do. Now, I was concerned initially about these vaccines because we'd never used nucleic acid vaccines before. They've never, in fact, to this day, have not been approved by the FDA. because I was concerned that they would produce an autoimmune response when these nucleic acids got inside the cells. But in a normal infection with this virus, the RNA goes in, it manufactures these proteins. Some of the proteins are released, some are inserted into the membrane of those cells, and our immune system attacks those infected cells. They've got little flags sticking out through the membrane that say, I'm infected, and our immune system will destroy all these viral infected cells. My concern was that with this RNA being introduced, we'd have a massive response where we destroy all these cells. But the catch is, no more cells are going to be destroyed than what was originally introduced, which is much less than what a viral infection would produce. So we actually get a lessened risk of inflammatory reaction than we would in a normal viral infection. So, and the same thing's true with the DNA. You'd worry about the DNA sticking around, but every cell that gets either the DNA or the RNA insert, those cells are going to be destroyed so they will not propagate. So the vaccines have shown to be safe and in particular very effective.